Great. Thanks, everyone, for joining early. We will give it a few more minutes and then get started just shortly after the top of the hour. So look forward to talking with all of you about a little quality improvement. Okay, thank you all for joining the call today. I'm just going to give it a couple of minutes to let people hopping off from another meeting join, and then we will get started. All right, so it looks like our trickle of guests has slowed. So we are going to go ahead and kick off with our webinar series for the month of January. I will say I had to definitely change the date. I had a big old typo of 2019. So Happy New Year to everyone on the line. I hope you had a great holiday season. And for those in Montana and Wyoming, I hope you're all staying warm. And for those of you in Hawaii, I hope that you're enjoying some sunshine for us. I know it's very gray and very cloudy here. Today, we're going to talk about how to leverage health information technology for improved outcomes. My name is Kristen Schuster. I'm with Mountain Pacific Quality Health. Here's a little information about our organization. I don't think that we're a stranger to many of you on the line. We work on a lot of different projects across a fair few of our states, Montana, Hawaii, Alaska, and Wyoming, as well as some of the territories out in the Pacific. So we specialize in providing healthcare quality improvement strategies, technical assistance, education, and outreach. We specifically look at clinic work, hospital work, and the vast majority of other healthcare organizations across our very beautiful states. My name is Kristen Schuster. I have over 10 years of experience in the healthcare industry. I started out in a practice, so I was a practice manager. So all of the kind of quality improvement activities I'm going to talk about today, I have executed with a variety of teams. Now I work more on the broader scale across the different states with different quality improvement programs. I work with the CPC Plus practices and have spent a good amount of time working in the meaningful use realm, the PQRS realm before those kind of sunsetted, as well as the new QPP and MIPS world. So my big focus is how do we utilize technology to get what we need to done in a more efficient way. Today during the presentation, and don't worry, I am going to send out these slides and the recording after this, so there will be no quiz on any of these acronyms. But here is a list of some of the ones that I'm going to be using today. I will try to remember to say them all out loud first before I start and jump into the alphabet soup that is the healthcare world that we're living in right now. So today's objectives, what are we going to really launch into? We're going to discuss the current state of health information technology and quality improvement strategies. We're going to learn the basics of electronic clinical quality improvement methodology, eCQI, and then learn to use strategy to identify, manage, and implement successful eCQI projects and improving outcomes, and that gold our kind of big pie in the sky goal of reducing burden. And then lastly, be able to apply the eCQI methodology for facility, health system, and community level improvement or engagement initiatives. There will be a good focus, and a lot of the examples I'm going to use are going to be around diabetes and cardiovascular disease. So where are we at right now? So the current state of things. So the introductions of HIT, EHRs, electronic data standards, and value-based payment models, all of this change really came about pretty quickly and have added a layer of complexity to the care that we're delivering. So today we want to talk about how quality improvement methodology can be used to address some of those barriers that we're facing with these really big changes in the healthcare continuum that we're seeing. So through clinical quality improvement and quality reporting requirements, you now have to use both clinical and HIT expertise to really ensure that you're getting the information in and out of your EHR. This is going to rely very heavily on having a standardized, documented process that you utilize with the different care team members across your organization, and then also having a consistency in your workflows. I'm sure that we've got a lot of different folks on the line that are using a lot of different EHRs. That does add another level of complexity to the whole thing. And then looking at the, different resources and what's available to you in your practice and who is going to do this work can definitely add a new level of burden to providers and staff. So today we want to talk about how you can utilize some standardization to hopefully alleviate some of that burden and build a base of knowledge that will allow you to address problems and kind of requirements no matter how they evolve and how they change in healthcare. I think if anyone's been in healthcare for more than a month or 2 months, you all are very aware that there's a lot of change in this industry, and we have to have our tools in our tool belt that will allow us to address the changes no matter how quickly they get thrown at us. So what are effective QI efforts? I am going to use QI, that is quality improvement, throughout this presentation. So what are they? So they need to have a significant return on investment, so a good use of resources. When you're looking at ROI, you may be looking beyond what financial ROI is and start to look at more of how you utilize resources effectively and efficiently, which then in turn improves your bottom line. It's looking at how we can really utilize each one of our staff members in a strategic way that allows them to practice at the very highest level of their license. By doing that, we need to be efficient and we need to be organized. Having a documented process in place ensures that no matter if you have staff turnover or if you create new projects, everyone on the team knows what the goals are so they know how their work impacts the goals of the company. Align with as many quality requirements or objectives as possible. If you've got a diverse group of practices, like if you're part of a hospital system, you may have some of your providers that are reporting MIPS. You may have some of your providers that are reporting CPC+. You may have an overlay of an ACO. The best thing that you can do is strategize how you can use quality improvement efforts to improve metrics that'll go across each one of those different service lines that you're looking at, and how you can really capitalize your staff so it means, many hands makes light work. Look at reducing the overall cost while improving outcomes and patient satisfaction. Patient satisfaction is a big one that we're starting to look at, and we're starting to hear more of coming out of CMS as a key indicator for how you are changing and improving on how you look at a patient's care. So keep that in mind. And then use advanced concepts that move clinics towards practice transformation. We are well on our way to a value-based care world. Fee-for-service is getting a little bit further in the rearview mirror, even though it's still around, but we are definitely moving into this value-based world where CMS and other payers are starting to look at how they can creatively pay for performance versus volume. And then lastly, establish practices or workflows that can apply to multiple chronic conditions or topics. So, like I said, cardiovascular and diabetes are very top of mind right now as I look at the different commercial and federal payers that we're looking at and rolling out different projects. But what we want to do is teach all of you how you can design these quality improvement activities to improve any condition that may be thrown at you. So next year it could be looking at patients with substance use disorders. It could be looking at patients that have been diagnosed with depression. So the condition itself is changing, but how we approach those conditions from a quality improvement standpoint stays consistent across all of the chronic conditions that we're looking at. So electronic clinical quality improvement, eCQI. So what we're looking at here is how optimizing HIT and standardized electronic data to achieve measurable improvement in quality of care. So for me, one of my big favorite things is garbage in, garbage out. So if you have an EHR that you're utilizing, they're designed very differently than a paper charting system. So it's very important that we understand how your health information technology platform is looking at and pulling reports based on the data that your care team members are putting in. You can't make lasting change through quality improvement if you don't have baseline data. That's a really critical component to all of this. You don't know where you're going if you don't know where you're starting. So incorporating the data and functionality of your EHR into your quality improvement QI projects. They're really one and the same right now. And again, it's looking at no matter what your complex chronic condition is, no matter what your QI project is, that it's based and its foundation is in the data where all of your patient's information resides. And then utilizing evidence-based clinical best practices and proven QI practices for rapid improvement. So we're going to go through the QI practices today. we'll touch on some of those evidence-based guidelines, but they're all over the place. They're all out there. So you just kind of want to marry the two processes to ensure that your quality improvement projects are going to ultimately lead you to those improved outcomes for those clinical conditions. And then lastly, looking at strategizing to maximize ROI and reduce burden. Just because something has been done the same way for a very long time doesn't mean that it's the most efficient way to do it. So you really want to look at the entire care team's perspective as you're working through these QI projects. There may be some great insight. You may need to incorporate, other care team members to reduce a provider burden and increase that efficiency. So keep that in mind as you're strategizing through your own unique QI project. So let's get to the basics. Like I said, we can't get to where we're going if we don't know where we're starting. So the basics is where we're going to start. So in the beginning, where is this coming from? Why are we talking about this? So through the individual state agencies, whether it be the Department of Health or the Department of Health and Human Services, any of those state entities started working with practices and began to invest in quality improvement strategies that focused on supporting chronic disease prevention to really improve data accuracy, provide a simple, scalable, and effective process for quality improvement, and use data to promote action. So I think you can see a trend across these 4 points that are all grounded in the foundational concepts of complex chronic care management and how that works with data in order to monitor, are your patients actually getting better? And if they are not getting better, how do we look at processes within your organization that will move that needle for that patient? So the focus of our eCQI approach, it's pretty simple. So accurate and complete use of electronic health record applications and HIT. If you're not vetting the data that's in your EHR, you're not going to have a clear picture of what your baseline data is. If you don't have clear baseline data, you're not going to know who your patient population is that you need to work with. And if you don't have the proper patient population, your care team members aren't going to know how to focus their efforts. So for example, if you have a patient population size of 5,000 patients, it can be pretty daunting to say care managers or providers, you need to take care of all of those 5,000 patients. We know that there's a hierarchy of needs within our patient population, and we have to figure out who within that patient population is that needs our care in a more focused manner. So through pulling our electronic clinical quality measures, we may identify of those 5,000 patients are patients with diabetes who are not meeting or who have an A1C greater than 9. So there you go. There's our list of patients that we want to do active outreach to improve their metrics. Essentially, there's our baseline data. But if we don't have accurate data within our EHR, there's no way we can figure out how to whittle that 5,000 patient population into a much more manageable bite-sized chunk. So then after that, we look at aligning clinical efforts and quality initiatives to reduce burden. So not only are you going to be looking at what CMS is asking of you, whether it be reporting to MIPS or CPC+, but you also want to look at your state payers. What is Medicaid looking at for quality contracts? What are your other state payers looking at? And choose your quality metrics and choose your QI projects so you're going to get the most bang for your buck across all of the different payers within your organization. And then using strategy to maximize results and performance. And this is where documenting your process and monitoring your outcomes over time really is going to allow you to make those changes and figure out if you made the right decision. And if you didn't make the right decision in one of your quality improvement projects, that you can quickly course correct and change something to see if that would work. So our eCQI approach includes using evidence-based clinical best practices. So there's no point in reinventing the wheel. If there's a standardized process for the protocol that our patients with diabetes have, we may as well go ahead and utilize that versus creating a whole new evidence-based guideline within our own practice. Leveraging and advancing EHR use. I'm going to say it, believe it or not, our EHRs definitely can be our friends, even though at times it makes us want to pull our hair out and it feels like they're working against us. But when I think about when I first started in healthcare and the paper chart runners that we had in our clinic and the different ways that we figured out how to get information out of the charts and how time consuming that was. And now I see the capabilities of the EHRs, even no matter how primitive or how bad they may seem, we are certainly leaps and bounds from those paper chart days. And if we leverage and utilize those and better understand how we can make the data within our EHR work for us, the better position we're going to be to really understand and capitalize on these different quality improvement initiatives, which will then kind of boost our ROI. Immediate partner of that means standardizing workflows, data tracking, and using data analytics. So without a standardized workflow, there's typically 10,000 places you can put information into a patient's electronic medical record. Oftentimes, the EHR will only pull reports from one place in the chart. So we need to create standardized workflows. So by utilizing the EHR appropriately, we can then get the reports out of the EHR to know exactly what our patient population is looking like. Those standardized workflows are very, very important. And then incorporating different quality improvement strategies. So looking at the agile iterative delivery model combined with proven quality improvement methodologies, such as the Plan, Do, Study, Act, will allow you to look at the changes that you're making within your organization and make quick steps to change if things are not working out. This is going to get you to a point of true efficiency. And then utilizing basic project management techniques. This is going to mean documenting and making sure that the team knows what the goal is. Those are two very big points of this. And then lastly, focusing on achieving value-added changes quickly and efficiently using quote-unquote sprints. So this is small steps to change so you can course correct quickly. My favorite thing is fail fast. If you fail fast, then you can go in and fix what did not work instead of failing slow and getting a year down the line in your project and not knowing exactly what actually failed in the project. So fail fast is something that I am a firm believer in. So why do this? Why do all of this work? What is the point? So we want to be able to track our progress over time. We want to ensure that the changes that we are making within our care team, whether it be hiring a care manager or nurse case manager to monitor our diabetic patients, maybe it's hiring a pharmacist to do medication therapy management or comprehensive medication management, we want to know if those changes are working and improving the overall health of our patient population. So through this, we can use that to monitor our progress over time, but then also report to the different quality improvement programs that are being rolled out by CMS and the other state reporting agencies. So it looks like we've got a kind of a diverse group on the line. So some of this is going to apply to you, some of it is not. I'm not going to spend a ton of time in any of these categories. That's an hour-long webinar in and of itself. But just so you know, the eCQI process is aimed to improve your clinical quality measures that are used in reporting. CMS quality programs such as QPP, NIPS. Within that, we have CPC+, IQR, PI. You may be looking at getting patient-centered medical home recognition through NCQA or one of the other entities. You may be reporting for GPRA or the Government Performance and Results Act. So all of these different quality reporting programs, you want to align what you have to report for these with the work that you're doing within your practice. So you're really capitalizing. And again, boosting that ROI because there is money tied to a lot of these different reportings. So what are the benefits? I think it's really easy for all of us to kind of get lost in kind of the administrative side of things and forget that we really want to increase patient safety, satisfaction, and improve outcomes. Why we're in healthcare, you know, we can't have healthcare without patients. So that's first and foremost our goal and a benefit of doing this work. Improving care coordination. So where are your patients going? As we look into this world of value versus volume, understanding what our patients' habits are and where they're seeking care is very important. Increase accuracy and effectiveness of data. So again, garbage in, garbage out, or looking at how we can better utilize our health IT systems to support the work we need to do. Standardize workflows and protocols. And one thing that I think falls under this is employee satisfaction. So when there's a standardized workflow and a protocol in place, there's never a question of what is my job, what is my duty, what do I have to do today? There's a workflow and a protocol in place. And having employed people and being an employee myself, those are things that I appreciate very much as an employee, is having that understanding of what my role is and how I do it. And then implement advanced care delivery concepts. So quality improvement is one piece of a very, very large healthcare puzzle. So as we're moving into this world of value, CMS and other state payers are expecting practices to evolve and change, and sometimes at a quicker rate. So we may be looking at how we can do things in a more streamlined manner, but by offering more service lines and more opportunities for our patients to engage in their care. For example, getting a behavioral health specialist integrated into your practice. That's a pretty new concept for primary care. Maybe hiring care managers to do care management for your patients that are at high risk. Maybe it's hiring a pharmacist. So all of this information will help you understand what you need, what you may want to incorporate into your practice as you evolve over time. And then reduce reporting burden by aligning these quality metrics across other contracts and across other programs. Hopefully you can report the same report across multiple entities. And then reduce costs and increase revenue opportunities. With these quality programs, like I said, there is some reimbursement that's tied to it. So there is opportunities to potentially get a little boost in reimbursement for doing some of this work. So we're just going to look at the kind of high level steps. For the sake of simplicity, we've kind of lumped them into these 4 categories. So choose a topic, choose a QI topic or project. We want to increase the number of patients that have hypertension, that have their blood pressure in control. Okay, there's the project. But then we need to create a project goal and scope. And this is where having kind of short-term projects of change is going to be very, very helpful. That goal is very big and it's very large, so we need to whittle it down into bite-sized chunks. So maybe we are going to create a home blood pressure program and help patients learn to take their blood pressure at home. So then create a list of potential changes and improvements. So within that, we have our patient education is going to be kind of first and foremost as we work with our patients at home to educate them on taking their blood pressure. We need to educate our care team members of what's expected of them to work with patients with hypertension. And then lastly, we launch into utilize, plan, do, study, act sprints. I like a month-long sprint where we assess the effectiveness of the project that we're working on. So how many patients did we try to recruit for our blood pressure program? Okay, maybe we got no one. So then we need to look at what did we do within the practice that resulted in no patients being interested in the blood pressure program. One thing we find is these new concepts of care sometimes are easier if they come from the provider because there's a typical kind of provider-patient relationship. So maybe the nurse was the one who was encouraging the patient to do the home blood pressure monitoring program. and the patients weren't receptive to it. I would then encourage my providers to try and recruit patients and do another sprint to change. So it's like the old scientific method, right? We take one thing and we change one thing at a time so you can monitor what is working and what does not work. Okay, so here's an idea of some project ideas. I just gave an example of a clinical quality measure within a practice. So when we're looking at the facility level, improvement of any clinical quality measures, implement interventions, protocols, and clinical pathways. So if you don't have protocols of care in place, you can easily do a PDSA cycle around those protocols to ensure that you're designing workflows and protocols that fit with the work that needs to be done within your clinic. Another one is improve patient outreach and education. So a little combo of that with the home blood pressure monitoring program. Obviously, it will improve our hypertension numbers, but we are also educating our patients and doing a little different form of outreach and empowerment with those patients. You may want to look at community outside the walls of your organization. So looking at reducing readmissions or improving transitions of care. So when patients are discharged either from the ED or the inpatient setting, maybe you want to improve what that looks like from your care team's perspective and improve those follow-up rates. Collaborate to improve immunization rates and associated documentation and outreach. I know I've done pneumonia campaigns, flu campaigns, Tdap campaigns to try and improve our immunization rates, because Montana Medicaid looked at immunization rates a lot. So we did PDSA cycles around what would work to get patients to come into the practice to get immunizations, or if the patient was getting immunizations outside of the practice, how we get that information into the patient's medical record. And then another one, collaborate to provide resources and expertise via telehealth. Maybe you want to explore some alternative visit types, and telehealth is kind of your weapon of choice. So looking at how you can implement some change tactics into your practice that will improve that. So where do you get started? So how to choose projects. Use current data to identify opportunities. Your clinical quality measures are I think the really good low-hanging fruits because they pretty much crosswalk with a lot of the different quality improvement initiatives that we're working on across the different states. So I think that's a great one. Another one, performance feedback or utilization reports from government programs. So if you're reporting to GIPRA or UDS or HIN, you may want to look at some of the reporting requirements that are expected of you on that annual basis or a more frequent basis, and make a choice around your project that aligns with those, because you got to do the work anyway. So you may as well, choose something that is going to align, so you're not doing something that doesn't align with this program or that program, and then you ultimately create more work for your staff, which no one likes, right? Maybe you want to improve your patient satisfaction surveys. So you want to gear up for your maybe annual CAPS reporting, or you want to get a different patient's perspective about the different things that you're doing within your organization. That may be a good project for you. Looking at the commercial payer feedback data. So you may look at individual metrics, like I gave the examples of the pneumonia and flu vaccines. Maybe that's what you want to focus on. Or HIE registry or statewide data. Maybe you want to do a quality improvement project around that to improve how that data is getting to the HIE, how information is getting back from the HIE, and what that workflow looks like. I think what you're going to see is there's no limit to what you can focus on. It just needs to be something that is agreed upon by the team and ultimately and ideally aligns with work that you're doing for other projects. So this is where being aware of all internal and external quality goals or requirements. And if you're part of a large organization, this can be a pretty daunting process. So you may find that you create a team that has people from multiple specialties across your organization. So you've got an idea of, what are they looking at from the inpatient perspective? What are they looking at from the outpatient perspective? And you can start to align those goals. If you don't take into account kind of your organizational goals, sometimes these projects can become very fragmented and lose steam. So know all categories of quality reporting. So looking at what you have to report, again, going back to that, and then identify any existing community resources to help meet or advance quality improvement. So looking at the many hands make light work. So if you've got maybe an FQHC within your community that is working on a specific initiative, maybe from a primary care standpoint, you can align what you're working on to hopefully improve the overall outcomes of your patient population. And then, again, I'm going to go back to kind of the multi-specialty because I know we've got a few hospital groups on the line, but looking at what your specialists are doing too. They've got their own quality reporting as well as primary care and all of that. So if we can share a quality measure across these different organizations, all the better. Okay. So when you're creating a project scope, so you want to keep it simple. So what are we trying to accomplish is the big question. And then establish a goal. Make it a SMART goal. I like this. So specific, measurable, actionable, relevant, time-bound. So it has to be specific, otherwise we're all just going to spend time spinning our wheels and not get anywhere. So think about those as you're trying to plan your QI projects, and define your evaluation measures. What are you going to look at to see how if your measures to change are working? And then identify project constraints and boundaries. I think time is a big constraint and boundary that I like to have. I like to have a definite beginning and end to my quality improvement projects so they don't drag on. You may need to have, a different time for the different projects. Maybe it's a month, 3 months, but you want to have a time where you say, okay, we're done with the project. We want to measure if it was effective or not. And then you make adjustments based on how you're answering those questions through your data that you're using. So popping back to my example earlier, so improve blood pressure control for patients with hypertension, improve clinical quality measure CMS 165. So I like this measure because it takes care of my MIPS reporting. It takes care of my CBC Plus reporting for my quality measures there. I know Blue Cross Blue Shield of Montana is looking at it. I know Medicaid is looking at it. I know Pacific Source is looking at it. Bam, that's great. That's enough. That's enough convincing me that I want to look at this quality measure. So you can see how I kind of crosswalk that with what I know is going on within my state and within my community. So then choose an eCQI project and create a project scope. So looking at the different ideas, so clinical quality measures, reducing readmissions, transition of care, all of these are fantastic ideas and are needed in order to create your project scope. So then we need to create a change backlog. So create a list of possible changes to help meet the project goal. So then as you're working with your team, and this needs to really be a team activity because these quality measures span a lot of different team members within your organization. It's going to affect your nursing staff, your provider staff, your health IT staff, your medical records staff. So it's a good idea to get your team's perspective because you also never know who's going to have a good idea of what may work. So then what changes can we make that will result in an improvement to the project goal selected? So this is where brainstorming ideas for possible changes that will ultimately improve the project goal and outcome and measure. So when I have my brainstorming sessions, I really like to say, like, there's no dumb ideas. Let's just throw things out there and then pick an idea that we want to land on. But sometimes the most harebrained, off-the-wall ideas end up being the thing that makes the best and most lasting amount of change. So think about that as you're working with your different care team members for creating these quality improvement activities. I always liked on my teams, I always like to have a provider champion that was willing to kind of take the risk and jump on this QI project for small tests of change. I would always like to have a nurse. I had a lab within my clinic, and if there was anything that was impacted, like say hemoglobin A1C, I would want a person from the lab because I don't want to make changes to someone's workflow that isn't going to help them or that's going to create a hurdle for them. I would have someone from the front desk. I would have someone from medical records. So I would have an assortment of people on the team to offer a variety of perspectives and to really ensure that we're understanding what the full scope of the thing we're trying to accomplish looks like. So then here's some ideas for your brainstorming. Depending on where you're at in your kind of quality improvement journey, you want to, first of all, probably see how accurate your baseline data is. Then looking at maybe there's EHR functionality that you can use that will leverage your quality improvement activities. You have standard, consistent workflows. This includes workflows in the physical space, your health IT space, your data entry space. So having consistency across those workflows is very important. And then looking at your standardized clinical protocols. As we're looking at especially these complex chronic conditions, there's protocols in place that can be utilized to improve efficiency and reduce provider burden by distributing those clinical decision makings across different members of the care team. And then is there additional training that would help support staff? There's some fantastic resources out all over the place. We're gonna have our contact information. So if you are looking for a specific resource, you can always reach out to myself or Patty Kasednar or Deb Anderson. We'll try and find you some resources because there's plenty of free resources out there for staff training. And then looking at existing resources or possible partners to support your improvement. Just because you're doing a QI project within your practice doesn't mean that you need to keep it in there. Again, going back to the many hands make light work and capitalizing on those relationships across your community to better leverage those supports to improve the patient's care. Okay, so EHR functionality in looking at this. Again, this is kind of something that we could spend a lot of time talking about, but I'm going to give it to you in kind of a quick blow-by-blow as we think about this. But this is going to help you create your baseline data. If you don't have data, you don't have a project. If you don't have a starting point, you don't have a project because you have no way of measuring what your change is over time. So looking at how your EHR can support best practices and protocol. The first one I think is one of the biggest ones. So computer provider order entry, or CPOE, is how you put information into your EHR and where. And can a report find that information? So for example, blood pressure readings. There's a very specific place in the patient's chart where their blood pressure reading goes. On the back end, there is a report that is written for that CMS 165, that hypertension measure, that when it is run, it knows that it needs to look at that one spot in the patient's chart to be able to pull their data out, and either the patient, falls into the numerator or denominator, or they don't. And so understanding what that data looks like is very important. And this is where you may have your first project just be about putting information into your system and making sure it's consistent across everybody that is touching that part of the patient's chart. You can also look at utilizing clinical decision support. These are kind of those pesky alerts that pop up that I think all of my providers wanted me to turn off, but I wouldn't. So, the patient's due for a colonoscopy and it pings and lets you know. Patient's due for a mammogram, it pings, it lets you know. So utilizing those alerts so you don't have to go into the patient's chart and manually audit to find out if the patient is compliant or non-compliant for one of your quality improvement projects. Looking at how you can utilize the patient portal through engagement. As we, expand our technology capabilities and our patient population also expands their technology capabilities, you may find that the patient portal is a good test of change that you want to utilize. Looking at patient panels, tracking, and risk stratification. So this goes back to my example of your patient population of 5,000. If you don't have a patient panel, which patients belong to which providers, and then a hierarchy of understanding of which patients are needing care, it makes it very confusing for your care team. So creating panels for your individual providers and then risk stratifying your patient population is a great way to start to understand what the needs of your patient population is and what the bandwidth and capabilities are of your team in order to take care of them. And then health information exchange. A lot of information out there. How are you going to get that information back into your EHR? How are you going to utilize that HIE to understand, where your patients are going? And then looking at interfaces and registries, you may have another population health interface that overlays your health IT platform. How can you utilize that in order to get maybe some additional information? Registries, how are you running reports within your EHR to find out who your patients and needs are? And then looking at population health analytics. So population health is kind of the big, the big target that we're all working towards. So a lot of these QI projects will ultimately impact and improve your population health overall. Okay, so there's a lot of different areas within your EHR that you can look at using. And I'm going back to the EHR consistently because I want you to understand how critical the data within your EHR is to create successful quality improvement projects. So as you're looking at clinical decision support or CDS, so target conditions and standardized treatments. So we've got our data display, which can be flow sheets within your EHR, patient data reports, and kind of just general displays that you're working with within your EHR. You've got your workflow assistance. So this is task lists, our patient status lists, integrated clinical and financial tools. I also put into this workflow assistance registry reports as well. So these may be custom reports that you're able to pull out of your EHR that will tell you in the last 6 months, who were my patients that had diabetes, that were seen, that did not have their A1C done. And then you have actionable patients that your care team members can work with through that registry report. And then looking at your enhanced functionality for data entry. So a lot of EHRs allow you to build custom templates that will allow you to pre-populate information into the chart through that template, which eases in the documentation burden. And also ensures that your structured data is put in the proper location. So one of the things that you can look at doing to reduce some of your provider burden is creating these templates and then having maybe an MA or a CNA pre-populate these notes into the patient's, pre-populate these templates into the patient's chart, so then the provider doesn't have to put all of that information in there manually. So there's some streamlining that you can definitely do that will improve this overall. And then decision making. So this is the alerts that I was telling you about, the patient's family preference, diagnostic decision support. So is the patient due for something? Are they not due for something? So a lot of these functionalities are within your EHR and can help your quality improvement processes. Okay, so we're going to go back. I'm not going to touch too much on that CPOE because we already touched base on that. But then looking at what patient education is available within your EHR, and then also looking at patient reminders. This is where those alerts kind of come into play as well. So see if you can set up reminders for your patients to come in for their A1C, reminders for patients' annual wellness visits, for their comprehensive medical review visits. All of those, you can explore putting an alert in the patient's chart so your care team members don't have to spend so much time going back in the history of the patient's chart to figure out what they need. Okay, perfect. Okay, and then lastly, lab interfaces, patient panels, and risk stratification. True to me, I have elaborated a bit, so I'm not going to dive into these too much just for the sake of time since we are coming up on the end of the hour. One thing I do want to point out, though, is care coordination and care planning is a really critical component that you can utilize within your EHR to track and follow up with your high-risk patients. This marries perfectly with risk stratification and how you prioritize the patients in your population with the highest need so you can ensure that your quality improvement project, you're targeting the right patients to really maximize the change within your patient population. So looking at your patients with hypertension that are not meeting their blood pressure goals, looking at your diabetic patients that are not meeting their A1C goals, and then prioritizing the care from there. Okay, so within the EHR, the whole big push is structured data. If you can't pull the information out of your EHR, the reports can't run and you're not going to have accurate baseline data. So this is really important as you're looking at how you use and enhance your EHR to really work for you, so we're not fighting against it as much. Okay, so we're looking at our change backlog example. So going back to our CMS 165 as just an overview of kind of how this looks and how it works. So we first looked at train all staff on select electronic workflow data entry for CMS 165. Train staff on accurate blood pressure measurements. Implement a hypertension protocol. Make sure hypertension is addressed at each patient visit. You can ensure this through your EHR CDS alerts. You also could ensure this happens by pre-populating a hypertension template within the patient's chart. And then see patients with hypertension with a blood pressure reading of greater than 140/90 every 6 months. This is another reminder that can go into your EHR. And some of the EHRs definitely have the capabilities where you can create a registry report where you can create letters and send those out to the patients for 6-month reminders. You can send email blasts to the patient's portal, just some different creative ways that you can look at reminding those patients to make sure they come in that aren't going to add an additional layer of burden to your care team. So let's make the EHRs work for us. And then implement care management and care planning for high-risk patients with hypertension. So we recognize and we see who our patients are that have blood pressure readings that are out of control. So what are we going to do with those patients? Through care management, you can identify their maybe psychosocial needs that are impacting their care, socioeconomic issues that may be impacting their care, implement self-management support and patient education through care management. It's really just the next step in kind of ramping up how we take care of our patients to really ensure that we're getting those improved outcomes. So documenting is a big thing. So making sure that no matter what your plan and what your goal is, it's written down and you're looking at all of the different areas of the problem and looking at how you can brainstorm as a team. And then keeping in mind the big letters at the bottom, all change ideas should lead to improvement of the overall project goal. If it doesn't answer the question, if it doesn't work towards that, then it's not a good goal to have. So you need to always go back to what is the problem we're trying to solve? Does this change tactic that we are going to implement, is it going to make an impact on that area of change? So then what you can look at doing as you work through your different quality improvement strategies is determine the first sprint of your PDSA cycle. So prioritize the list of possible changes from your change backlog. So just again, using the scientific method, like we're only going to change one thing at a time so we know what works and what doesn't. And this is where these small steps to change or sprints are very necessary because it's easier to change something a month in than 7 months in. So you will create a goal for each individual sprint and PDSA cycle, which will help improve the overall project goal from the project scope. So we have a link in this webinar that will send you to our Mountain Pacific PDSA worksheet template. We have all of this information out there. There's no need to recreate the wheel on PDSAs, man. There's literature all over the place out there. You can customize it kind of as you see fit, but don't spend an astronomical amount of time trying to find a PDSA cycle. So what does it look like? So step one, have to identify the goal or purpose, and then formulate our theory, define success metrics, and create a plan, essentially our hypothesis. And then we're going to implement components of the plan. That's the do part. So let's let's just dive right in and get to work. Then study, we're going to monitor the outcomes to test validity of the plan for progress and success or problems and areas of improvement. So we need to monitor to always ensure that what we stated we wanted to do is working. And if through the study process you find that this is not working, we move into our act, which is closing the cycle. So you either go back to the drawing board and reformulate the theory or change the method, or land in our goal happy place of this works, this is what we want to be our protocol moving forward. So sprint, changes small enough to quickly and efficiently gain rapid value-added improvements. Okay, so things to keep in mind: establish a SMART goal. It's really, really important. Use standard data measures so you can monitor your change over time. Stressing that a lot. You've got to be able to measure what you're doing. And then things to keep in mind: establish realistic goals. So in a month's time, you are not going to solve all of the world's problems for hypertension. Not going to. So let's focus on the areas of hypertension control that we can impact and we can change within our practice. And then it should be short. So sprint, 30 days, like I said, that's a great amount of time to spend focused efforts to see if this works. And then using project management. So have an owner of these PDSA cycles, someone that's documenting the project. Keep it consistent, just like our protocol for care. Use a template to document your protocol for your PDSA. Have regular team meetings and reportings, so you're very aware of what is going on, what's working, what's not. So then when we get to the end, our act, you can adjust the plan as needed. So looking at this, I mean, it's just a cycle of repeat. No matter what your quality improvement project is, no matter what your clinical quality measures that you want to look at are, it's just one cycle of change. So we identify the project scope and team, we create or update, depending on where you're at, and prioritize the change backlog, create our PDSA, perform and complete our sprint, again, ideally in that 30-day magic window, perform sprint review with your team, and update change backlog, and repeat. So there you go. There's our cycle of change as we work through these different quality improvement projects. So here's a kind of a flow sheet of how it looks. You can keep, again, this is just another template that gives you an idea of how you can kind of educate your team on what this looks like, so you can explain a little bit more of the why, with our ultimate goal always being that stabilize and spread. So we make small steps to change, to figure out what works, so then we can then spread it across our organization and make that then the protocol that we base all of our work off of. Okay, so we've got about 5 minutes left. So I want to zip over to this. Okay. I want to get to our results. Okay. So here's some eCQI projects that are kind of tried and true. You can see that there's a different focus for the different quality measures, but they're all quality measures. So through these quality measures and these PDSA cycles, with the guidance of one of our subject matter experts here in Montana. We are here for you, so we are happy to work with anyone that wants to pursue these quality improvement projects. There's really some drastic changes and improvements to each one of these quality measures. I mean, some of them as staggering as, a 48% improvement through closing the referral loop for breast cancer screening. I mean, really astronomical swings. So when you're looking at your quality numbers and your quality reporting, or maybe you're getting incentive payments for performing with your commercial payers, thinking about how you can utilize PDSA cycles to improve your overall quality measures that could potentially lead to greater reimbursement, but more importantly, greater patient care. So I think these numbers are incredibly exciting to see. And These were just very small steps to change. So think about how you can maybe take these ideas, crosswalk them to your quality improvement contracts that you have, and capitalize on that improvement. Okay, so we've got some resources here. Like I said, there is no need to reinvent the wheel. There is a lot of information out there, and we are definitely here to help. I'm going to chat in my email address to the group, but you can also contact a couple of other folks here. But just think about how you can go ahead and choose quality improvement activities within your organization that align with a lot of different projects, and then find the tools that you need and the subject matter experts that are going to get you to where you need to go. So it looks like the chat has been a little bit quiet. I don't think it's any surprise to the folks on the line that know me. I see Cynthia and Karen out there that I talked a lot during this presentation. So if there are any questions, please feel free to chat in your questions before we close out this webinar. Okay, I'm not seeing any questions come through the chat. I did put in some additional email addresses for contacts. Please feel free to reach out to any of your state representatives if you want to know more about quality improvement activities, especially around the hypertension and diabetes. I just think it's such a critical conditions that we're looking at, and really does crosswalk across a lot of the work that we're already doing through these different initiatives that are coming out of CMS as well as our state payers. So thank you all so much for your time. I really appreciate that. This webinar will be recorded, and we will go ahead and distribute that out to you. So if you had team members that were not able to attend the meeting today, you'll definitely get a chance to hear this recording. So thank you very much, and I hope everyone has a good day, and again, Happy New Year.